said, I love this comment. I gotta repeat it. Everybody wants to be a gangster till it's time to do gangster shit. Like, take the NCLEX. That's real gangster. That is so gangster, taking the NCLEX. That's no joke. I can't. Hello and welcome back to the Nursing Hustle. My name is Natalie, and today we are going to get into this topic about new ways to respond when someone tells you they're a nurse when they're not. Now, I'm just having some fun here. We've gone into the new year. I am going to be getting into the topic of those $100,000 jobs, but I just thought I'd just have some fun. And I will continue to have fun along the way because why not? You know, these are all these topics that I'm going to be talking about are all topics that are relevant to us. Maybe may make us laugh a little, may make us cry a little, but anyhow, it will get us through, right? Because every nurse needs to laugh a little. So anyway, new way I respond when someone tells me they are a nurse when they're not. Now, before I get into this, I'm going to read this to you, and then we're going to get into some of the comments. Drop me a comment and let me know if you've ever run into anyone that has told you they're a nurse and you knew they weren't. And you know what? If you know if you can tell us how you knew they weren't, that would be great too. All right, let's go. This nurse says, for some reason lately, more people I meet out in public tell me they're nurses before I tell them I'm a nurse. But they do not have the vibe of a nurse. Do we know what the vibe of a nurse is? Are you vibing with me? Yeah, nurses do have kind of their own vibe, don't they? Let me know what you think that vibe is. Let me see. So I have been asking people, I have a question about nursing. And then I say NCLEX, and all of them say, I don't know what that is. Okay, is that a dead giveaway? There is no nurse that is a nurse that does not know what the NCLEX is. I don't care if you're an RN, associate RN, a BSN RN, a master's RN, a CRNP, you know what the NCLEX is. So, and then she just says, well, I just say I'm drunk right now and maybe my brain isn't working, just so that she doesn't get into it with them. Very interesting. I live in Florida, and we had an incident here in Florida where nurses got licenses, but they bought them, right? Like, so that was a big thing. You can do a search on the internet. I haven't researched lately to see what's been going on with that. But so that, I know that's a thing, like nurses, people faking to be nurses. So I'm not surprised, but someone actually saying they're a nurse when they're not. And I wonder, I guess I'll have to research to see. I guess those nurses, maybe they paid someone to take the NCLEX for them, or maybe they didn't, because if they didn't and they just got handed somehow a license from somewhere, I don't know how they would have gotten it from the Board of Nursing, but someone would have had to take the NCLEX. Anyway, I digress, because this was just interesting to me. I don't know if I've ever run into anyone, and personally, that's really strange because I don't generally tell anyone I'm a nurse. I mean, here, because this is a nursing channel, but I don't go around telling people I'm a nurse. That's like, I keep that that's in my arsenal. If I need to pull that out and tell someone, like in the healthcare system, if I go see a doctor, my kids are having a problem and I need to pull I'm a nurse and I know what I'm talking about, then I pull it out. And even like in the general public, if someone asks me what I do, I just tell them where I work, because it's an awkward question. And I don't like to if I don't have to, usually, and drop me a comment. It's kind of funny because I think that nurses try to get out of their nurse mode when they can, because it's such a stressful job. So you're not trying to go out there and tell everybody you're a nurse so they can ask you a million nurse questions. But anyway, I digress. So anyhow, someone says, if I ever admit to being a nurse in public, it's because my patience is running thin and I want the information given to me straight. Sometimes I walk into my own patient's room and run out the door like, no, I'm not the nurse right now. Exactly, right? That's what I just said. Like, who's trying to be the off-duty nurse? Usually not, right? Like, so like if you've worked a 12, 16-hour shifts, 4 12-hour shifts, the last thing you're trying to do is like tell somebody you're a nurse and go back into nurse mode so they can ask you questions. So you just kind of keep it to yourself and you just, keep it humble. Most nurses are pretty humble about what they do. Anyway, I think. Drop me a comment down below. Maybe not. Maybe it's just some of us. Maybe some of us like telling people. But there's nothing wrong with that. You're a nurse. You're a nurse. You want to tell people, there's nothing wrong with that. Okay. Someone says, bingo. Anyone who's claiming to be a nurse to someone they don't know is AF. It's sus AF. Yeah, so suspect. That person is suspect because I try not to tell anyone. Sucks that what you do for work is such a common question. Exactly. I try not to tell anyone either. Oh, I only admit to being a nurse when a discount may be involved. Where? Are there discounts? What discounts are there for nurses out there? I don't know. I don't know, where was the last time I went somewhere and they said nurses get a discount? If you guys know where there's a discount for nurses, where there are discounts specifically for nurses, drop that down. I'm sure other nurses might want to know. Oh, look, someone says I bought a Lululemon belt bag. Felt like a total felt like a total dickwad. Batting my eyelashes and saying nurse discount 15%. Yep, she got a 15% discount at Lululemon in case anyone wants to know. Haven't shopped there yet, but may have to go for that 15%. All right, let's move on. Someone says I legit asked them what specialty they're in. That alone lets you know. Or I'll go, oh, LPN, RN, and see how they answer. You'll be amazed how many times it turns out to be a tech. Nothing against techs. I was one before becoming RN. So was I. But I never claimed to be an RN when I was a tech. Exactly. Don't do that. Don't do that. Why? Why would you do that? Okay. Why are so many? Somebody asked. That's my question. Why are so many people faking that they are a nurse? Can somebody answer that? Why do you think? Oh, someone says they think our job can be done with no education, and simultaneously they think it makes them sound smart and that they can yell at real nurses freely. I can't. It's too much. Like, what craziness is going on out there? Oh, especially since less than 1% of the US population happens to be nurses. The fakers are bound to run into lots of nurses during their fabricated career. Oh, certain situations in the US in recent years have caused people to have a faltering grasp on truth and reality. So there's that. So is that true? Let's fact check. What percent of the US population are nurses? Let's look. I just had to look it up to see, like, for real, what percent of the population is actually are nurses, and there is only 0.17, which is almost 2% of the population are nurses. So yeah. So I guess because they figure the likelihood, if they tell people they're nurses, the likelihood of them running into a nurse is unlikely because they're, the population. Wow, that's so freaking crazy. I didn't know that. Did you know that? Okay. Anyway, I really digress, but that's really interesting fact. Okay. Don't they know that your nursing license is a public thing? Anyway, I don't know. What are people thinking? Like, that's like me getting on here and saying I'm a nurse and then I'm not. Like, why would I do that? Like, why would you do that? Gosh, I almost feel like I'm feeling like called to like, and I'm not going to do that, but I'm feeling called to post my license up now because, like I'm on social media and like to imagine like somebody's going to get on here and lie about being a nurse. It's like that's like me coming on and saying I'm a doctor. I'm not a doctor. Like, why would I do that? Oh, someone says everyone wants to be a nurse, but nobody wants to wipe booties. Say what? Yeah, guess what? That's part of the territory for all you people out there, all you weirdos out there trying to claim that you're a nurse when you're not. Like, are you kidding me? Someone says, same thing with docs. Everyone wants to be a doc, but no one wants to do the 10 years of post-secondary. Snap. Exactly. Do you know how long doctors are running internships? I used to work at a hospital, a teaching hospital. The doctors are running ragged. They're not sleeping. These interns. Doctor interns. Yeah. Because they got to do internships before they can, and then they have to be, they work under the attending. I forget what they call them. I can't remember right at the moment. But, yeah. I worked at University of Pittsburgh Medical Center. My goodness. All right, let's go on.
I love this comment. I gotta repeat it. Everybody wants to be a gangster until it's time to do gangster shit. Like, take the NCLEX. That's real gangster.
That is so gangster, taking the NCLEX. That's no joke. I can't. Okay, same way people say they work in healthcare when they are arguing how to perform a clinical skill, but what they mean is the admin desk or accounting. I can't. Okay. I feel like the issue ramped up post-COVID. So many conspiracy theorists and anti-vaxxers needed some level of credibility but didn't have it, so they either beefed up their education and credentials, or I don't know about that. Maybe that's true. Either way, it's insanely cringy and embarrassing. It is. It's very cringy to get on and say that you are something that you're not. I mean, and this is something, it's a registered profession. So it's not like there's not documentation to back that up. There's plenty of documentation. Hey, but then we had nurses here in Florida buying their licenses. Crazy shit, right? Crazy shit. Without the experience, I'm scared. That's really scary. That's really, like, on a serious note, that is seriously scary to think that you have. I know I talk a lot about on this channel about that nurses are, that we learn as we go. But we have some basic needed skills when we come in. When we come into the profession, there's some, basic skills that you need. And I'm not saying that anybody can't learn it, but go do the testing. Like, there's a lot of information. Do you guys remember taking the NCLEX? That shit is crazy. Like, and all the studying you have to do and all the recall that you have to do of everything that you learn during that nursing school about different medications, about Lasix, about just the basic meds, right? That you have in your mind. Like, this is not something that you just jump in one day. You jump in and you're coming into the practice with that knowledge, with some of that basic knowledge that's going to help you guide you through your patient's vital signs to keep them alive. I can't. Okay. Most of the time, someone says, most of the time I figure they're just ignorant. They don't even know what the scope of practice is. And that there's things they can or can't do. I used to work alongside a non-nurse, truly not even sure what her credentials were. that had been in her role for 20 years. So many of her non-nursing coworkers just assumed she was a nurse too. And I have to say that, you can work as a CNA and acquire a lot of skills, but there is a scope of practice. So there's certain skills that you can't acquire. You can have the knowledge, but the skill set is not there until you're actually hands-on. Let me tell you. Somebody could tell you all day how to hang blood, how to check blood, but until you have administered blood to a patient, it's a different thing, because you're checking and you need to know a lot of things before you hang that blood. What if your patient has a reaction? What are you going to do? Do you know what to do? Do they know? You know what I'm saying? Like, you nurses out there, you know what I'm talking about. Okay, they're often shocked to learn that the person was unlicensed working. Oh, they were often shocked to learn that she was unlicensed working under my delegation since I am so much younger. She would often do or promise things that would be done, and I have to tell her absolutely not. So yeah, that's the other thing. When you have a CNA working under you or a tech working under you that's offering patients like things that you're going to do, and you're like, yeah, that ain't happening. Not on my dime. No, I'm not the doctor. That's needed from the doctor. So that can put you in a bind. So it's good to have good collaboration with your nurse's aides. My God. Someone said our leadership had no care for the situation. Honestly, I was worried if I brought it to the state that it would fall back on me somehow, since I was the one with the license and the only RN that she worked under. Wow. Yeah. So, when we're this brings to light something that I wasn't expecting, a topic that I wasn't expecting to come up here. But when they say that you're responsible for delegating to your tech, right? But you have to know their scope. You have to understand, and they have to understand their scope of practice. Now, I'm going to tell you what, like, if I didn't, this is where there's a fine line, because like, if I didn't delegate something to my tech and then they claim that I did, right? They are still, like, how can they claim that I delegated to them something that was in their scope of practice, and then they went ahead and did it, not knowing their scope of practice? There's something wrong with that. And why would that be my fault? Why would that be? And, so there's like, it's very, we put up, us nurses, we put up with so much. There's so much. And that's why, when you work in the hospital, it's really good to have that nurse's insurance, because you never know what kind of bullshit people are doing, and it's not under you. And they're going to try to blame you for it. Ooh. Someone said I had the opposite issue. I was a CMA before I got my RN, but I was very conscious of making the distinction when asked, especially because I was working towards being a nurse. I didn't want to claim it until I earned it, because I wanted it to be special when I did. It's one of my pet peeves when people automatically call anyone with the back part of a doctor's office a nurse. They don't generally have many RNs, maybe LVNs, but for the most part, they are medical assistants. Yeah. I got called into the office once because the patient said I called myself a nurse. I knew I absolutely hadn't. I don't know what exactly happened, because I hadn't done it. I had no clue who would even had made up the claim that I did. It was dropped. I kind of assumed a patient said the nurse said XYZ, and it blew up from there. Yeah, exactly. Because patients don't know either, right? Because everybody, it used to be a long time ago, years ago. I've been a nurse for 30 years, and even then, it was coming to the end of the time for nurses to wear. I don't know if you guys know, like, Florence Nightingale. Well, we should all know who Florence, like, if you're a nurse, you know who Florence Nightingale is. But the little white cap. So that little white cap, like, nurses used to have some type of attire that would distinguish them. But now when you go into the hospital, everybody's wearing the same scrubs. You know, sometimes some hospitals will distinguish the color of the scrubs that nurses wear. So I think the University of Pittsburgh Medical Center kind of does, but but to the patient, it all looks the same. The doctors are in scrubs, sometimes the attendings and the interns will have white lab coats, but everybody's in scrub, from the med tech to the CNA to the nurse, the LVN. Everybody is in scrubs. So how does the patient know who's who? Everybody. So it's just like everybody's like, oh, that nurse was in here, and you're like, what nurse? Like, I wasn't in the room. I never saw I never talked to the patient, and then come to find out, like, the respiratory therapist was in there giving them a breathing treatment. What? Okay. I ask if they know that impersonation is literally illegal. Yeah, a lot of things are illegal and people still do it. So I don't know. I don't know if that's going to deter anyone per se, if that's what they want to do. Oh, if someone says in Canada, you're not even allowed to call yourself a nurse in a province you're not registered in. Damn. Wow. Because ICURN says, I don't know that rule, but I always say I'm a janitor when I travel anyway. Yeah, nurses do not typically want to tell people that they're nurses. And they just, especially you're traveling, I'm on a plane. I'm going to get on a plane and tell everybody on the plane I'm a nurse. I don't want to talk to the person sitting next to me the whole flight about their medical problems. I don't. If they have an emergency and I need to step in, that's one thing. They need CPR, that's enough, but I don't want to talk to someone after working 12-hour shifts and I'm trying to take a vacation and be on the plane talking to someone about their medical issues. No, I'm good. Thank you. There's a fine line, but why are you lying? That's the thing. Like, what is the purpose of lying? Like, do you think there's prestige? Like the one nurse said, come wipe some booty then, because I've wiped plenty in my day. And it's not fun. Oh. Do you guys know, like, trach care? Yeah, we couldn't give them that, but trach care is not fun, right? Don't stand in front of that patient while you're doing trach care. And so if you're a nurse, you know what I'm talking about. You'll be sorry. Anyway, well, this was just for shits and giggles. I don't know. We don't know why. It's like scam. Like, they even think, like, the housekeepers in the hospitals now, they all wear scrubs. So they walk into the patient's room and the patient thinks the housekeeper's a nurse too. So everybody just looks the same. Maybe we need to get back to, like, wearing distinguishing uniforms that identify us, But with these long shifts we wear, those scrubs are more comfortable, But damn, maybe there should be something. It used to be nurses had to wear all white, and we don't wear all white anymore. That's when I graduated. We were wearing all white. In my my graduating class. All right. Well, I could go on and on and on and on. And so somebody just last joke, right? Nurses that are tired of hearing this. Someone says, Nurse Flo no or something. Anyway, she says, I have also reached this Zen level. It's nice to quote Keanu Reeves, 1 + 3 = 3. Yep, you're right. You're correct. And have a lovely day. I don't have much time left in my life, and I'm not arguing to idiocracy. Yeah. Uh, everybody's asking, why are people saying they're nurses when they're not? I don't know. I worked as a CNA too. I was a CNA before I became a nurse. I worked, as I was going to school, and I would never dared to tell somebody that I was a nurse. And if they identified me as a nurse, I quickly corrected them. Quickly. I saw how hard the nurses were working on the floor when I was in school. While I was there, because as CNAs you work hard too. I know. Been there. But anyhow, let me know what you thought about this. Drop me a comment down below. Let me know what you do and what you say if this happens to you, and what kind of situations you guys have seen out there. I would love to hear it, because I always need a good laugh. Anyhow, let's keep working and hustling smarter and not harder. Until next time, I'll see you in the next video.